Hello everyone. It's a pleasure to meet you in both the online and offline learning environments. My name is Jae-hyo Kim, and I am a professor at the College of Korean Medicine at Wonkwang University. Today I'd like to introduce the basic principles of safety, hygiene, and infection control that should always come first in acupuncture treatment. Acupuncture treatment is a comprehensive therapeutic approach that includes several methods, such as acupuncture, moxibustion, and various types of manual therapy. Today I will focus on the knowledge and precautions you need when applying acupuncture to patients in clinical practice. First, an acupuncture needle can be defined as a variety of medical devices designed to be inserted into or to stimulate specific areas on the surface of the human body, based on traditional Korean medical theory, for the purposes of treating disease, preventing illness, and promoting health. Using these instruments, acupuncture treatment can be understood in a modern sense as the entire process of acupuncture therapy, which includes the practitioner palpating the patient's body to locate acupoints or meridian-related anatomical tissues, inserting the needle into the body, and performing manual manipulation after insertion. Of course, many textbooks and experts describe acupuncture needles and acupuncture practice in a more conservative way, grounded strictly in traditional Korean and Chinese medical theory. You can think of my explanation as a more modern, practice-oriented interpretation to compare with those traditional definitions. The reason I frame it this way is that acupuncture is inherently invasive, and I want to emphasize how crucial safety, hygiene, and infection control are whenever we perform acupuncture treatment on patients. Next, I'd like to give you an overview of the acupuncture treatment process. We should not think of acupuncture as simply inserting a needle into an acupuncture point on the patient's body. Rather, it is a structured diagnostic and therapeutic process designed to produce effective treatment outcomes. In other words, safe and effective results can be achieved only when every step is properly followed. Acupuncture treatment can be divided into 6 main steps. First, we begin with diagnosis and treatment preparation. This can be summarized as a thorough assessment of the patient's condition, including pulse and tongue diagnosis. Second, based on the diagnosis, we select the appropriate acupoints for treatment. This involves locating specific anatomical landmarks and meridian points, and by this point, you have already studied the basic knowledge of the 14 meridians and their related acupoints. Third, we perform the precise insertion of sterile needles into the body. Fourth, we try to induce the therapeutic response known as the Deki sensation. To do this, we repeatedly use manual needle manipulation so that the patient can feel and experience Deki. Fifth, after Deki is achieved, we retain the needles for a certain period so that the therapeutic response can develop into a clinical effect. In other words, the needles are left in place for the prescribed therapeutic duration. Finally, we complete the treatment by removing the needles properly and paying attention to the insertion site, including basic wound care. Now, I'd like to explain the steps of acupuncture treatment in more detail. The first step is diagnosis and preparation. In traditional Korean medicine, this means analyzing the patient's symptoms and signs through traditional diagnostic methods. We can summarize this as conducting a thorough medical history review and physical examination. In TKM, this also includes pulse and tongue diagnosis to identify imbalances in qi and blood. Once the patient's condition has been assessed from a traditional Korean medicine perspective, we can establish a treatment plan. At this stage, we define clear therapeutic goals, select specific acupoints, prepare sterile single-use needles, and make sure the patient is in a comfortable and safe position before treatment begins. During the initial stage of clinical observation and diagnosis, the practitioner evaluates different biological signs to understand the patient's overall condition. We usually do this through visual inspection, palpation, and inquiry. For example, we look at the color, coating, and shape of the tongue. We also examine the pulse at the 3 positions on both wrists. In addition, we ask about the patient's sleep, digestion, and the nature of the pain. Once we have observed, evaluated, and diagnosed the patient's condition, we move to the second step, which is selecting and locating the acupoints for treatment. Palpation is especially important at this stage because it helps us find ashi points or tender nodules that may need treatment. To locate the acupoints accurately, we combine anatomical knowledge with Kuhn measurement. We also check the skin and subcutaneous tissue for changes in temperature or texture, because these can reflect pathological reactions related to the patient's condition. Before performing acupuncture, we must also disinfect the treatment area carefully with 70% alcohol to ensure proper hygiene and infection control. The third step is needle insertion. Insertion should be quick in order to minimize the sensation felt at the skin level. The angle and depth of insertion are determined by the anatomical location and the patient's body condition. The goal is to pass through the skin barrier quickly while maintaining full control of the needle's direction and path. Next, let's look at the main ways we insert acupuncture needles into the body. In general, we can divide insertion methods into 3 types: perpendicular insertion, oblique insertion, and transverse, or horizontal insertion. Perpendicular insertion is mainly used in fleshy areas, such as the buttocks, thighs, and abdomen. Oblique insertion is typically used near vital organs, or in regions where the muscles are thinner, for example on the back or chest. Transverse, or horizontal insertion, is commonly used for points on the head and face, or over the sternum, where the skin and subcutaneous tissue are relatively thin. Even after we insert the acupuncture needle, therapeutic effects do not automatically occur. If the level of stimulation is not appropriate for the patient, the response may not be strong enough to produce a clinical effect. Therefore, depending on the patient's condition, we apply additional physical stimulation with the needle, and the patient experiences various subjective sensations. When these subjective sensations are linked to a therapeutic response, we call this deki, or the deki sensation. Deki refers to a variety of feelings that the patient may experience around the needle, such as heaviness, distension, soreness, or a radiating sensation. These occur because the skin and underlying tissues are physically stimulated, and sensory receptors and nerves are activated. At the same time, the practitioner may feel that the needle is being grasped or held by the surrounding tissue in the subcutaneous layer. This needle grasping sensation is also considered part of deki. To induce deki, there are several ways to manipulate the acupuncture needle and provide physical stimulation. One common technique is lifting and thrusting, which means moving the needle up and down. In general, rapid thrusting is used for reduction, while gentler thrusting is used for tonification. Another common technique is twirling and rotating. This means rotating the needle between the fingers, and small, controlled movements help maintain the deki sensation over time. In modern Korean medicine, electrostimulation is also used to control the amount of stimulation more precisely. This involves applying a mild electric current to the inserted needles, and it is often used for chronic pain management. Once deki has been induced by manipulating the inserted needle, the next step is needle retaining in order to maximize the therapeutic effect. In general, the retention time is about 15 to 30 minutes, although it can vary depending on the patient's condition. During this period, the patient should be placed in a calm and comfortable environment, with quiet surroundings and dim lighting to help relaxation. At the same time, the practitioner should check the patient's condition regularly and continue to monitor them throughout the retention period. Once the practitioner determines that the patient has had a sufficient therapeutic response, the inserted needles are removed. During this step, the needles should be withdrawn smoothly and steadily. After removal, direct pressure should be applied with sterile cotton to help prevent bruising. The used needles must be disposed of immediately in a designated biohazard sharps container. The practitioner should also provide basic aftercare advice, such as encouraging the patient to stay hydrated and get adequate rest. With this, I have explained the 6 main steps of acupuncture treatment, and next I would like to move on to the topic of safe acupuncture practice. Across the world, including in Korea, there have been various reports of adverse events and accidents related to acupuncture treatment. Recent Korean data on medical accidents show that acupuncture-related cases are ranked first, making up 40.63% of all reported accidents and 32.77% of the total compensation amount. If we focus only on side effects during acupuncture treatment, vascular injury is the most common, and nerve injury is ranked 6th. Together, these two types of injury account for about 60.3% of all anatomical tissue damage related to acupuncture. Next, I'd like to briefly introduce some adverse events that have been reported with acupuncture treatment. There are cases of local inflammation caused by pharmacopuncture, which means injecting herbal extracts. Bee venom pharmacopuncture can sometimes cause severe pain shock or even anaphylaxis in sensitive patients. More serious acupuncture-induced conditions have also been reported, including pneumothorax, sepsis, granuloma causing spinal stenosis, hemorrhage in the cisterna magna, necrotizing fasciitis, spinal cord infarction, and chronic hepatitis C, as well as rare skin tumors such as giant dermatofibroma. In addition, moxibustion has been linked to spinal epidural abscess in some case reports. There have also been fatal adverse events associated with acupuncture. For example, there are reported cases of shock and death caused by a hematoma in the neck region, leading to spinal cord compression after needling. There are also cases of death due to pneumothorax caused by lung injury during acupuncture, and cases of death following spinal cord injury after needling. Of course, similar accidents and fatal events can also occur in Western, biomedicine-based medical procedures. Therefore, we should not overestimate or exaggerate the risks of acupuncture compared to other medical treatments. However, it is important to remember that acupuncture is still an invasive procedure that can seriously affect patient safety and even life. As healthcare professionals, we must continuously improve our professional knowledge and technical skills so that we always put patient safety first. Now, you may wonder why such serious adverse events can occur during acupuncture treatment. The case I will show you here involves a patient with gastrointestinal symptoms who received acupuncture at CV12, a commonly used point for digestive disorders located on the upper abdomen. In this case, the needle was mistakenly inserted into the liver within the abdominal cavity, which led to internal bleeding. Many people think that acupuncture is very safe simply because the diameter of an acupuncture needle is usually less than 0.3 millimeters, which is much thinner than a typical injection needle or a surgical scalpel. However, if the needle is inserted incorrectly and stimulates an internal organ, it can still cause irreversible damage at the cellular and tissue level and may become life-threatening. In the CV12 case we just discussed, the needle actually penetrated the liver parenchyma and caused bleeding inside the liver. This is a good example of how a thin needle can still lead to a serious complication if it is not used properly. In fact, the liver is not always located under CV12 in every patient. In our research team, we used ultrasound imaging to examine the area around CV12 and found that the position of the liver relative to this point can vary depending on the patient's body type and abdominal shape. This means that, during acupuncture treatment, we should be able to imagine and explain exactly where the needle tip is located inside the body and what structure it is stimulating. Only when we can mentally simulate this three-dimensional relationship can we perform acupuncture that is both safe and effective.